Hello, everyone, and welcome to a special afternoon with tea with a fertility godmother. I'm really excited today to have a special guest to talk to us about male fertility and preconception care. We're going to have Dr. Paul Turek, who is an internationally known thought leader in men's reproductive and sexual health care and research. He's also the founder and director of the Turek Clinics and a leading healthcare resource for men worldwide. So thank you so much for joining us, Dr. Turek.
Absolutely, Denise. Wonderful to be here.
Thank you.
Nice to talk to you again.
Yeah, you too. You too. It's good to see you. For everybody out there who joins us, we're going to have a few questions that Dr. Turek's going to help us with, but please go ahead and post any questions or comments that you may have in the comment section here. All right. You ready? Can we get started?
Let's do it.
Okay. So, Dr. Turek, can you share with me your thoughts about men getting healthy before a couple tries to conceive?
Yeah, it's a good idea. I think all men should get healthy before. So if you think about reproduction, it's occurring in a larger system. And the farther we go into genetics and epigenetics and all this stuff about fertility, the more we realize that the basic health of the organism matters the most. So, for example, in patients who have vasectomies, who want reversals 15 years later, when I meet with them, all I care about is how well are you taking care of yourself over the last 15 years? Are you leading what I call the fertile lifestyle, which basically means taking great care of your health, like eating well, sleeping well, maintaining your weight, avoiding diseases as you can, reduce your medications, and don't do a lot of things like the social habits that we all do nowadays. Cut down on those. But it's all about living well and living healthy. It really matters. It matters on almost every level. How much sperm you make, the quality of sperm you make, the genetics of the sperm you make, the epigenetics of the sperm you make, the health of the kids you make. It's incredible. It's all sort of coming together as one big happy thing.
Yeah, great. I couldn't agree more. That's great. Is there a certain amount of time? So you said like you should live your life like that, but what if a couple came in and they didn't have this education? Is there a certain amount of time that you would recommend before they actually did try to conceive?
So I don't think it's exclusionary to not live. I mean, most people don't live a perfect lifestyle, but the point is try to be as healthy an individual as you can in general, because reproduction depends on that. It doesn't mean that if you don't live a perfect life, you're not going to be able to reproduce. It's just the link is stronger than ever right now. To overall health determines reproductive health in a lot of ways. But I think a lot of people. I did a study where guys came in with normal sperm counts with infertility, and I cleared them. And I said, I don't think it's you. I'd like you to try longer. Some of them got mad at me and said they couldn't figure out what was wrong. Some people tried harder, didn't say. But then I found out that some couples said, well, Turek couldn't figure out what was wrong with us. But that's not what I told them. I told them that he's fine and that they should try harder. But I gave them, I didn't fix anything. I didn't give pills. But I did advise them to live, eat well, sleep well, reduce your stress, take an antioxidant supplement, and be healthy. Live your life, treat your body like a temple and live a healthy life. And I think they did that, because what I did was I called them up a year later. I had a student call them up and looked at the natural pregnancy rate the year after I told them that. And it was 65%, which was more than anything I could have offered them. And probably anything anyone could have offered them. And I didn't touch them. I just gave them lifestyle advice. So the treatment was lifestyle treatment.
Right.
And they did it on their own. So I'm a big fan of alterations in lifestyle. And I would say, I don't think I would tell a couple to hold off for 3 months until you stop smoking and but I would say certainly cut down that stuff as much as you can and try to get off it. And, don't lose weight rapidly, lose it at a pound a week, because that can drop your sperm count more if you lose it rapidly. But certainly stop the hot tubs and stop the pot and stop the edibles and all that. And I think, it just improves their rate. So I don't think I'd hold them back, but I think everyone's got a little tweaking, and that can be all they need.
Right. Yeah. Just really focusing on having a healthy lifestyle. And
it's bigger than we think. It's one of the biggest things. And that's why the acupuncture, TCM, Chinese medicine community, I love it because they take care of the whole person, and they're looking at all that. And so when I get infertile men referred by, practitioners like you, they're all sorted out. I mean, their stress is sorted out, and their diet's right, and they look great, and they usually have something anatomical going on that I can fix. So it's like a real 1-2 punch for those couples to get that kind of treatment.
Nice. So you mentioned about bike riding. We get a lot of questions about that, like bike riding, hot tubs, boxers or briefs. Do you have any comments about that?
I'm bicycling. I'll just say I have a blog called Turek on Men's Health, and it's called Cycling into Childlessness.
Okay.
Cycling into childlessness. And it just breaks down the hard data where that came from, and a lot of people are worried about bicycling. So one issue with bicycling is if you're getting numb in the saddle, you're at risk for erectile dysfunction. Okay, so best to have a custom-made seat, and I just had 2 guys convert to that, and they're all excited about it. If you look at fertility, the data that led to that statement was professional Spanish bike riders, Tour de France caliber bike riders, who are doing lots of things like growth hormone and steroids and blood doping and all this. And, the extreme athletes, and, extreme exercise isn't necessarily good for fertility. They looked at their sperm counts and their semen analyses and found them to look not so good, low counts, bad morphology, and concluded about their fertility, which was incorrect. But I looked at that study, said there's nothing about fertility in this study. And then if you go to the blog, you can click on the study. And then I presented the study that I thought was more relevant, which was a English commuter lifestyle study where commuting cyclists in England were examined too, not in the same study, but they looked at people who, rode not competitively, moderate exercise, but bicycle to work, and looked at not their sperm counts, not their semen analyses, not their morphology, but their fertility, which is the only measure that matters. And they found that their fertility in these commuting cyclists was way higher than the average English person. So I'd say, if it reduces your stress to go cycling, I would do it. Make sure your pelvis doesn't get numb because you're at risk for ED, and I wouldn't worry about fertility.
Great. Well, that's great information. I know there's a lot of guys out there that will appreciate that like to cycle.
So, hot tubs. I did the hot tub study. Yeah, get out of hot tubs.
Get in a hot tub.
If you raise the temperature of your testicles with a flu, a fever, a hot tub, a bath, you're going to knock down sperm production for sure. It's very impressive. And so, this is part of the healthy thing is don't do things. Edibles and pot. Everyone thinks, well, I'll just use edibles. It's not as strong. No, it's different. You actually you get more THC and DD and what was the other ingredient that DB? What's the active ingredient in pot?
The THC is the one I'm aware of.
Well, THC, and there's the other one, but the other 3, mnemonic of 3. But the pot issue is when you smoke it, you get a peak and you feel it really quickly, and then you slow down because you've got the effect. But when you edibles, you typically it's a softer peak, so you tend to consume a lot more to get the same feeling, and then it's sometimes too strong and it lasts longer. So honestly, the dose of THC is much higher with edibles. And I worry about all of this because there's good data that it hurts counts and morphology, and I'm sure it will be shown soon that it affects DNA fragmentation, and I'm sure it'll be shown soon it'll be an epigenetic issue if you do it long enough and hard enough. Because the ultimate, I think, factor here is the epigenetics of the sperm, which is like not visible on a semen analysis and not visible, but it's causing an underlying problem. It's kind of the new perfect storm coming up. We're realizing that a lot of this stuff reflects lifestyle issues over time, and it affects sperm in a very profound way that can now be measured. And Episona, who's sponsoring this, Episona, the company, has an assay called SEED, which is you can order at home or order through a doctor, and that can pick up a lot of this stuff, which is really subtle. And they have some preliminary data that, pot affects the marks on the DNA of the sperm, and the marks on the DNA of the sperm determine its fertility.
Yeah, the test is exciting to be able to break through some more information and I think put a little bit more spotlight on the man because everything's been more focused on the woman.
Yes. I mean, we have a 50-year-old semen analysis, which has no relationship to fertility except if it's 0.
Mm-hmm.
We have, and that's what most men get in America anyway. They don't get a history and physical. We don't learn about their habits. I've seen men have no sperm counts coming up for IVF because they were normal, but no one told them to get out of the hot tub, and now it's IVF and there's no sperm. And, disasters like that. But you got to take care of the whole guy. Right. And the epigenetic stuff is going a little deeper in a way that no one else has, and it's finding things that make a lot of sense and make their lifestyle very relevant to their fertility.
Yeah, I love that test. It's great. When you have what I ask here? So if a couple is trying to conceive and they've been having difficulty for 6 months or a year, at what point do you recommend that they do get a semen analysis to check as a baseline, or even if it's before that, do you ever recommend?
So I typically, I work in urban areas, Los Angeles and San Francisco, and 6 months to those couples is a long time. The woman's 37, 38. So I don't postpone anything in my practice, but if I worked in a rural place where everyone's 30, I might say try longer, but typically I'll evaluate them when they come in.
Right.
I won't just say try harder, because I'll get that response, which is, he doesn't really care or whatever. Right. So it's just that, you should try a little bit. I'm even negotiating with patients after I fix their varicoceles or improve their fertility, how much time they're going to give me naturally before they go on to some technology. And I want 7 months because the average time to conceive is 7 months. And they say, I'll give you 5. And I'm like, okay, let's see if we can do 6. Can we do 6? So it's hilarious how much of a negotiation. You're negotiating on behalf of the man to have sex at home to conceive, right? That's the negotiation. I think it's hilarious. It's really a moment in time for me when I do those negotiations, and I just love it. It's like a Turkish rug negotiation, right?
A Turkish rug, very cute.
Right? It's like I want to. You go back and forth. It's bartering, right? Bartering.
Yeah.
Anyway, I think that's that. And when you say evaluation, I don't do a semen analysis. I do a history and physical first.
Oh, well,
that to me has, in a board question that I wrote, what's the single most important piece of information you could get from a patient about their fertility? Which would you choose? History, physical, semen analysis? I'd probably choose the history, because if there's prior paternity, especially in that relationship, that's pretty strong that he's probably fine.
Right.
And close number two would probably be the semen analysis, because if it's 0, which is a 5%er, then it's going to be significant, and it would predict infertility. Other than that, it might not. It might not. So I do a history, a physical, and a semen analysis. On average, in America, a man who gets evaluated by someone maybe not like me, say a gynecologist, will get a semen analysis. And I'll just say the one take-home point is the semen analysis is not the man, but the man is the semen analysis. So this is the blog from last week, right?
Okay.
Does the man make the semen analysis, or the semen analysis make the man? And I played on the ancient paradox of the chicken or the egg, which came first, which is more important. And the answer, I'll just give it away. The answer is they both matter. The semen analysis makes the man fertile, and the man makes the semen analysis fertile. So it is one big happy family. But it really have to look at the whole guy. And on average, about 20% of American men get that evaluation when they seek it. They usually just get an evaluation of their semen analysis, and that is notoriously uninformative.
Misleading, right? Yeah,
uninformative.
Right, because there's so much.
That's
more
what I like
to
about
it,
epigenetics and things that go deeper, because it's giving us a lot more information that we can bring back and make changes, right? So before we had nothing, and we don't know what to change. Now we know, if you are overweight and then you lose weight, the epigenetics of your sperm changes dramatically, and probably for the good. So now we can say, we can actually measure things now with this test and say, this is probably a problem. I would advise you do this. And maybe your natural fertility would improve. So especially in cases of unexplained infertility, where everything looks great and everyone's happy and everyone's healthy,
Right.
There could be epigenetic issues that are real and sort of your personality. It's like a fingerprint. They may not be modulatable. They may just be who you are, and it's just sorry. We don't know enough about it. And then there's other epigenetics that might be modulatable or mutable, changeable with diet and good exercise. We don't know the details yet, but that's the way it's sorting out, and it's very exciting.
It is exciting.
We've spent 20 years shrugging our shoulders at guys. I don't know what's wrong with you. Keep trying. And now we're saying we have an idea what's wrong, and this is the kind of thing this reflects, and this is what you should work on, because guys do like tasks. And if you tell them to do something, they usually do a good job. And if you give a number, they can usually respond to that number. So it's nice.
Yeah, it is. And I think it's nice because some of them feel so like they want to be able to participate. And there's not much for them to do.
One of the things is antioxidant supplements are, that's a big story in the last couple, should men be on prenatal supplements or preconception supplements? And that story is a great one. The best data is Cochrane reviews. And there's two of them because the first one came out so powerful. The second one just said maybe if you do it, study it harder, it won't be true. But it confirmed it, which was that when men take an antioxidant and of some kind, their partners at IVF are more likely to conceive and less likely to miscarry by several fold. And so the data is rivaling that for women in preconception pills that they've been doing for 35 years.
Right.
So I have one called Essential Beginnings that as soon as I saw the first paper, we started creating one that would be herbal, mineral, and vitamin oriented, called Essential Beginnings, and it's called XY for chromosomes. And, I'm going to start studying that. I'm going to study it for epigenetics and things like that, because I think diet is a big part of it, and this sort of rounds out your diet. Is it good for everybody? No, I think if you eat a perfect paleo Mediterranean diet, you don't need a vitamin probably. You're doing a great job, but for the average guy who travels and eats airport food a lot, it's probably a good idea.
That's true. We have a few people visiting us. Does anybody have any questions before we call this to a close? No, I'm seeing if anybody has. We have nobody. I guess you're doing such a great, thorough job. So is there anything before we go, Dr. Turek? Do you have anything you'd like to anything else you'd like to say or get out that's important? Any tips?
I think that the biggest tip is when women get an evaluation, men should also get an evaluation.
Okay, there we go.
I think, this is a disease. It has, from our research from 10 years ago to now, men with low sperm counts have other things going on, right? It's not all epigenetics. They could have, they're at higher risk for cancers later in life. Their longevity may not be the same. Their comorbidity burden, or their disease burden at the time of infertility is higher. So I view this evaluation for men as a very important way for us to get our foot in the door and take better care of young men, right? So this is the canary in the coal mine. This is the sign of something bigger. So that's my real intent, is to get men better care, because I'm a firm believer that men are underserved. And it's a complicated problem with a long discussion with multicultural components to it. But what a great way to get a guy some care, not just the semen analysis, some real care, by saying, your wife can't conceive, you should, do it for her. So the woman should say, the partner should say, or the partner, do it for me. Do it for me. Because honestly, my goal when I see that guy is, let's get him the kid, but let's get him healthier too.
Right.
Right? Because you get him in the 30s or 40s or 20s, you've got 50 years of health there that you're going to gain. So I'm going to add years to their life. And as a physician, classically trained physician, that's a gold mine for me. And it's just that no one's been able to tap into it. And I think we have a way to get into it. So don't tell the guys that we're trying to help them out. Don't tell the guys.
Don't tell them, I know.
It's like they'll come in and they'll say, I need you to stop smoking. And they'll say, I can't. And I said, well, go to Puff Daddy in Boston. Here's the information. He's worked for everybody. You'll stop. They come in, my wife's pregnant. Great. And I said, are you still smoking? He said, no, I stopped. It worked great. Thank you. And I said, thank me. Yeah, I just added 5 years to your life.
Right?
And that was, that's the goal of a doctor, right? Keep people
healthy. That is the goal. Yeah, that's something that we focus on.
That's really what I'm happy about. He's got the kid. That's great. But and the kid will add years to his life too, because he realizes it's not about him anymore, and all that risk-taking behavior goes way down, right?
That's right. It's the beauty of having a family. That's awesome. That's great. Yeah. So healthy lifestyle is the biggest takeaway from today, is what I'm getting now, and making sure that the dad gets checked, or the man gets checked along with the woman, to make sure, and to really focus on getting a whole health history, not just a semen analysis.
And a good physical exam, because you can detect cancers and things. Yeah.
Yeah, and you do the physical. You do the complete physical exam.
Yeah, one visit. It's all one visit. Quick. And I try. I try to do it even sometimes in on site, so I don't have to do it in my office. But the idea is you're going to get one shot at a guy. Don't try to get everything you can done, because they're gone.
They're hard to get in. I know. They're hard to get in. I try to just talk to them on the phone sometimes, and that's hard.
Good luck.
Yeah, right. So, well, Dr. Turek, how can people find out more about you and your services? Where can they find you?
The website's a good place. It's about 400 pages long. It's a book. It's called theturekclinic.com, theturekclinic.com. And most of my thoughts about things you're asking about, like the semen analysis, I think the best blog is Reading Your Cards. That's the name of the blog. So if you go to Google and search Turek blog, Turek blog, or turekonmenshealth.com, and just put Turek blog semen analysis, and you'll get an archive of it. It's 10 years old. It's a prize-winning blog. I need to turn it into a book, but it's really all my philosophies all wound into one place. And it's nice to have, a glass of cold water, not wine, and sit down in the evening and just read these 4-minute bursts of information.
That would be great. So I don't know if Haley can post that now for us, but we'll definitely make sure that people can have a link to those, to your website and those blogs.
Yeah, and I'll usually start, if someone's got a question, I usually start with a call, just a call, and talk about it and see if it's worth coming in. And that's a nice way to sort of put a carpet down before you hit the hardwood, that kind of thing. I think it's a softer way to get in, and then people realize there's a human at the other end, and they actually care about me, etc. Because we are reintroducing men into the medical system, basically, with this kind of evaluation.
Yeah, I love your mission. I think it's fantastic. Let's keep our men healthy.
Well, thank you, Denise.
Oh, he's brilliant, very knowledgeable.
That must be my mother. I think she's.
Oh, and let's see here. Let's see if there's anything else before I let you go. I appreciate your time so much. I know you're very okay. That's it. Well, thank you so much. It was great to see you.
Episona is episona.com, EPISONA, and they have great blog too, and they have a great explanation of what that's all about, because epigenetics can be intimidating.
Yeah, there's a lot of people don't know so much about it right now. Right. Episona, they're a great company. We use them in our practice too.
Very forward-looking. I really like them.
Yeah, that's great. So that's another one for you guys out there. All right. Well, thank you again, and take care. We'll see you soon.
Until next time, Denise.
Until next time. Bye-bye.